Michelle Nesky, the Posh PA, and today I'm going to break down for you the biggest differences between a nurse practitioner and a physician assistant or physician associate. So an NP versus a PA. Now, you may have encountered either of these professions in your clinical practice or maybe as a patient, or maybe you're just looking to know what the differences are between the two as you're looking to go into a medical profession. And so on the surface, we can seem very similar, right? Both professions are licensed medical practitioners that can assess patients, diagnose, prescribe medications, increase access and quality of care to patients. So what are the differences between the two and what makes them unique? So let's break it down. Before I do that, however, if you have not already, hit the subscribe button. I'm here every week dropping new videos to help you along your journey into medicine. Also, I have a free community. The link is in the comments, which is also where I am spending a lot of my time connecting with students and certified PAs and offering advice and knowledge and guidance every day. So check that out too. Okay. So in my opinion, the biggest differences between an NP and a PA lie in the education and training, in clinical hours of experience, and in jurisdiction. What do I mean by jurisdiction? I mean in focus or specialty, and then also in scope of practice and law. So we'll talk a little bit of that at the end. So nurse practitioners have a nursing background, so are generally nurses first and typically hold a master's degree in nursing. And they're trained to provide a wide variety of healthcare services, including diagnosing, treating illness, prescribing medications, but they also have a strong focus on preventative care and health promotion. PAs, on the other hand, have a medical background and typically hold a master's degree in PA studies or in medical science or even in health science. They're trained to perform many of the same duties as doctors, including taking medical histories, performing exams, ordering and interpreting diagnostic tests. They also have the ability to write prescriptions and assist in surgery. Both NPs and PAs work under the supervision of a licensed physician, but their scope of practice may vary based on state regulations, and we'll touch on that later. The clinical training for a nurse practitioner and a PA are similar in many ways, but they're also a little bit different as in terms of their focus of the clinical training, okay? So NP programs typically have a stronger emphasis on primary care and chronic disease management. NPs are, again, trained to provide a wide variety of services. They also have a very strong focus on health promotion as well as patient education. NPs are also tend to have a more trained to have a more holistic approach to patient care, looking at the overall well-being of the patient, which includes physical, emotional, and social aspects of their health. PA programs, on the other hand, have a stronger emphasis on more primary, acute, and emergency care. PAs are trained to perform many of the same duties, again, as physicians, and like I mentioned above, writing prescriptions and ordering diagnostic tests. They're also typically more hands-on in surgical training and procedures, which prepares them to work in that setting. So both PAs and NPs are supervised during their clinical training, which gives them the hands-on experience they need to work in the variety of these healthcare settings, such as hospitals, clinics, and private practices. And so that's important to note as well. The amount of clinical hours tends to differ between the NP and PA experience as well in terms of training. So the amount of clinical hours that an NP receives is really dependent on the specific state or focus or jurisdiction in which the NP is licensed. So when you enter into an NP program, you do choose a focus. So whether that's adult critical care or maybe neonatology or pediatrics, you get trained under that umbrella. And so the focus can be a little bit different depending on which track you choose. Most NP programs require a lot of clinical experience, and the National Council of State Boards of Nursing requires that APRN education programs, so NP education programs, include at least 500 hours of supervised clinical practice. This is in addition to usually around the 1,000, 1,500 hours of clinical experience that's typically required to become a registered nurse before going into an NP program. Some programs may require even more clinical hours, depending on the specific population and focus of the program. For example, a program that prepares an NP to work with children may have more clinical hours in pediatrics than a program that trains NPs to work with adults. And so there is a stronger emphasis on primary care and chronic disease management, as I mentioned above. But you can see how that might differ based on the focus that, the NP program of your choice is. PAs receive a significant amount of clinical experience as well. PA education programs are typically 2 to 3 year graduate level programs, include both classroom and clinical rotations. And the Accreditation Review Commission on Education for PAs, the ARC-PA, which is the accrediting body for PA programs in the United States, requires that all PA programs have at least 2,000 hours of clinical rotations in a diverse range of settings, including internal medicine, family medicine, pediatrics, surgery, OBGYN, emergency medicine, and behavioral health. So it is a more generalist education. The clinical experience is supervised, the same as for nurse practitioners. It's also worth noting that those applicants who typically get into PA school have already a baseline of 2,000 hours of patient care experience on average, some more and some less. So in terms of the total amount of hours, it's going to fall more heavily in the PA, training versus NP. But again, NP is different based on focus, based on state, so and based on program. So, but that's how they differ in that way. It's also important to note that both professions require continuing medical education to maintain licensure and certification. And so those hours continually add up over the years as well, as we continue to gain clinical experience. In terms of choosing a focus or specialty, as I mentioned before, NP programs, you choose an umbrella on which you would like to focus. So whether that's pediatrics or whether that's adult critical care or whether that's psychiatry, and your training is more focused in those areas. Whereas PAs are trained in a more generalist way, doing rotations in all those different specialties that I mentioned, which will prepare you to go out and work in any specialty across the lifespan. So in that way, the professions are different. So as a PA, you can move between specialties. For example, if I wanted to work in pediatrics and then a few years later go into dermatology, that's possible. It is possible to change specialties within as an NP as well, but you do have to remain under your umbrella. Okay, so that's the main difference there. Lastly, when it comes to scope of practice in state law, there are more states currently that allow NPs to practice independently than PAs. PA laws are changing and becoming more progressive, but if you are looking to own your own practice, NPs have more flexibility there in terms of more states allowing NPs to practice independently. PAs are able to open their own practice in conjunction with an MD, definitely in certain states, but still working on that there. So just an important difference to note as well. I hope this helped you in terms of breakdown of how the education and training is a little bit different for both, and how once you're out into practice, the focus and specialty, as well as scope and things like that, are different between the two. If you have questions, please drop them in the comments. Let me just reiterate, though, that both professions are amazing. Both professions are trained to go out and work in a variety of medical settings in which you can impact patient care. You can order and interpret diagnostic tests, perform physical exams, do minor procedures, and really be able to focus on, preventative medicine and primary care, and improve access to care for patients, as well as the quality of care. In my opinion, you can't go wrong with either profession and choosing which one is best for you. But hopefully, if you're not choosing and you're one of these professions, you're super happy in your choice and you just wanted to know a little bit more about the difference, so that when somebody asks you, hey, what's the difference between an NP and PA, you have a little bit more information there too. So hopefully this gave you a little bit more clarity. And again, drop your questions in the comments. I'd love to answer them for you. And we'll come to you again next time with more information. See you soon.